Okay. Okay. So this talk, the topic is considerations for quality of life and end of life care, and when and how to make hard decisions for our equine patients. I feel like this topic is not talked about enough, and it's something that a place like Halleck Creek and therapeutic riding centers deal with a lot more often because they have a high population of horses and a high population of older horses typically. So it's a good topic that April brought up that we should discuss. So we'll go through an outline here, and then at the end we'll have some questions at the end. Let me just fix my screen for a second because I can't see everything. Okay. So on our outline, we're going to talk about a little bit about average lifespan of horses and a little bit of general info about older horses, some common elderly horse ailments. I know my last talk was on aging equines and things we can do to help them and considerations for that. So we're just going to briefly touch on it. And if you want to go into that more, I think my last talk was recorded, or April has the PowerPoint, and she can share that with you as well. What we're mostly going to focus on is quality of life assessments in our horses, and then how to make decisions on when to euthanize our horses and what that might look like. So the equine lifespan, domestic horses typically are living these days 25 to 30 years, and then that's in comparison to wild horses that are typically only living 15 to 20 years. So this discrepancy in age is due to all of our oversight, additional care, our acknowledgement of their needs in older horses, and the fact that we're domesticating them and protecting them from predators, helping them to live, 10, 15 years longer than they normally would. But this also means that they're dealing with things that their bodies are not designed to deal with. So things like dental health, muscle condition, just quality of life in general, as they age. And so because we are domesticating these horses and we are in charge of their care, we have to be advocates to ensure that we're helping them to live longer lives, but these longer lives have to be pain-free and beneficial to them. It's not fair to just keep them alive just because they're still alive. So those are the kind of decisions that we're going to talk about later. So just briefly touching on the aging process, a lot of this you can relate to humans, right? So when you think about when we're getting older, your GI tract becomes less efficient, it becomes more sensitive, your musculoskeletal system starts dealing with things like arthritis, it's harder to put on muscle and keep muscle mass, which leads you to be weaker. And then you have old injuries that start to stack up as you age. So if you have an injury when you were young, and then as you age, it's not getting better. So that's compounded on top of your arthritis, your decreased muscle mass, contributing to your weakness. Then their immune systems are less robust. As we know, older populations, we need to be better with their vaccines because they're not as capable of handling these insults that are thrown at them with just little viruses and things like that. They'll be slower to recover. And then their dental health, their teeth are expiring because they're not designed to live this long. So we have to accommodate that with special diets. And a lot of old horses are dealing with this condition called EOTRH, which is equine odontoclastic tooth resorption and hypercementosis. This is what Odie had. This is what Buck had. If you guys know those horses on the property, those are considerations that we think about with old horses and pain. And then we have to have these special diets for these horses because as their teeth are expiring, they can't chew their hay properly. They're not going to put on weight, and they're going to be really prone to choking, as a result of that. So those are all just kind of basic considerations of our old horses that we touched a lot on in the other talk. So when we're looking at our old horses to assess, their quality of life, we're going to look at, again, their dental health. This is actually in the top left here. This is Odie before he had his teeth taken out. And this is an x-ray of what those teeth kind of look like with the roots being all bulbous and abnormal and even cracked there in the root. It's very painful. These are also horses from Halleck Creek that have, this is an old injury that this horse has that now we need to manage and make sure that he's comfortable as he ages. And then this is an example of arthritis that also needs to manage and get comfortable as he ages. So we're doing assessments on these horses at Halleck Creek all the time. We're doing blood work on them to just make sure their organ function is good, their kidney liver function is good as they age, and running tests like Cushing's tests and things to make sure these diseases of older horses we can manage and know what we're up against when we're managing these old horses. We're also watching these horses trot on a lunge line pretty frequently. We're trying to make sure that they're moving comfortably. You can see this horse in this video isn't moving very comfortably. He's kind of lame on the right front. He's kind of stiff behind. So those are like subtle things that we're noticing and trying to pick up on before it becomes a bigger problem. And then we're doing a lot of flexion tests and palpations to try to localize these areas of pain in these horses so that we can make better treatment plans for them going forward. So, how can we ensure that our horses are going to have a good quality of life into their older age and age gracefully? There's kind of three brackets that I put things into. One is their environment. So, you have to consider with older horses that they have really good footing, that they have really deep bedding to lay down in, that they're getting blanketed more because usually they have less muscle mass and it's harder for muscle mass and it's harder for them to thermoregulate. So we have to take that into consideration. We also need to look at herd dynamics, which is a big thing that people miss with older horses. Some horses have lived together for a long time, but as they age, maybe one can't eat as fast as the other horse, and therefore one's getting all the calories and one is not, or one suddenly becomes a bully around the other horse in terms of food. And so we really need to pay attention to this year by year because maybe that herd population needs to change. Maybe somebody needs to be pulled out and put in a different herd. All those are environmental considerations. Also, with regards to footing, we're looking at the environment they're living in. Is it slippery? Is it on a steep hill? Can that horse handle that footing to maintain a good quality of life? And then pain management. These are things like anti-inflammatories, joint injections, maybe joint supplements. Again, environmental considerations. All of these are to help our horses not be painful in their older age. And each horse's plan is tailored specifically to them and what they're dealing with to treat them properly. And then dietary considerations, we touched on like dental health. We're doing dental exams on these horses every year. It's really important in older horses more so than your middle-aged horses because again, as they age, their teeth are expiring. Some are getting loose. They're getting the EOTRH in their incisors maybe. And we need to make sure their dental health is good because if not, then they're going to have decreased calorie intake. They're going to lose weight. They can choke. They can have all kinds of secondary infections if their teeth become loose and abscess. And then again, the herd dynamics of feeding these horses with other horses that are either on the same diet or eat at the same pace is a really important thing that people don't take into consideration with older horses usually until it's like a big problem. And then when we address it, it's a really easy fix. But if we can prepare for that ahead of time, we can avoid that kind of them going backwards and then picking back up weight once we fix it for them. So, what is quality of life as a whole? What are we talking about when we use that term? So to me, quality of life in horses refers to their daily comfort, their ability to express natural behaviors, the absence of distress or pain, and meaningful engagement with their environment. So this goes beyond just survival. It reflects that these horses are thriving through physical, mental, and social well-being. And I think all of those are really important. And some people only focus on the physical, but I think the mental and social aspect are things that we easily forget about, but they're equally as important as the physical, in my opinion. So why are we assessing these things? It helps us identify chronic issues like pain, laminitis, arthritis, when they're small problems before they become a really big problem and it's harder to get on top of them. These will guide our decisions on medical treatments, adjustments in diet or meds, and planning for end of life. And then it supports transparent and compassionate discussions with owners in terms of doing these assessments annually in older horses or even biannually, depending on the horse and his quality of life at that time, and making sure that we're preparing every step along the way and that everybody's on the same page. So there's no surprises in the process. So when we're doing quality of life assessments, there's kind of five domains that we're looking at. One is physical health. So things like weight, coat, locomotion, how are they moving? How is their appetite? How are they eating? Pain or discomfort, again, lameness, how are they moving? How are they standing? Are they shifting weight a lot? Are they not laying down? Are they sensitive to palpation, maybe on their back or their neck or other areas that we can address? And how is their behavior and mood? So, are they bright? Are they socially interactive? Do they want to work? Or have they suddenly become grumpy and lethargic and despondent? How is their environmental comfort? So shelter and turnout and their overall comfort in their specific environment is very important. And then nutrition and hydration. So access to quality forage and water intake. And this is something that is very important to think about. I mean, everybody pretty much has quality water for their horse to intake, but what people fail to think about sometimes is my horse has arthritis, their water is on top of a hill, and therefore that horse is not going to walk up that hill as much to get water. So these are conversations we have. What can we do to help this horse drink more water, right? We can move the water down to the flat part of the hill. We can give additional buckets of water. We can give them mashes so they get more water. So that's more what I'm talking about rather than just providing your horse water, because I think everybody understands that your horse needs water. So when we talk about the physical well-being, this is their physical well-being and then their ability to meet their biological needs. So these are kind of the factors that I'm thinking about when I'm assessing a horse's quality of life in regards to their physical well-being. So their degree of pain and discomfort. And this can be looked at on a static basis. Like I said earlier, how are they standing, their posture? Are they standing evenly on all their feet? Are they unweighting one leg more than the other? Um, Presence of any health conditions. Does this horse have Cushing's disease that's unmanaged that we can start to treat them for and they will start to feel better? Their level of energy. Is this horse lethargic and despondent? And some people chalk this up to just their horse being old, which is a factor. As horses age, obviously their energy decreases, but there's a difference between natural aging, energy decreases, and then kind of lethargy and disinterest. So that's kind of the difference I'm looking for there. Sleep patterns is a huge one. We talked in our other talk about how important it is for horses. They have to lay down to sleep to go through REM sleep. And if these horses have arthritis and they don't want to lay down, then they're not going to sleep. They're going to start having sleep deprivation, which leads to a whole cascade of problems. So this is partially, are we providing them an environment that's good enough for them to sleep in, that's soft enough, safe enough? And also, are we managing their pain so that they want to lay down and sleep? And then their herd dynamics as well. How about the horse's ability to move around, stand up, get up from lying down? That's kind of what I was talking about with the last one. Are they willing to move around their pasture? Have they decreased how much they move around their pasture? These are all things to really keep an eye on in older horses. Their ability to chew food. Are they dropping quids of food? Are they less interested in their hay these days, more interested in their mashes? Some horses, as they age, just get really picky about what they want to eat. And so sometimes we just have to change up their food pretty frequently to kind of keep them interested. Appetite and water intake, similar as the last one. And then their ability to maintain normal body temperature, which kind of directly correlates to their body weight and their muscle mass. So if they can't maintain weight or if they don't have enough muscle mass, it's going to be harder for them to maintain their body temperature. And this is where we might need to address their diet or any underlying conditions. Pain is a known factor to losing weight. So are they in chronic pain and therefore it's hard for them to gain weight? Getting to the bottom of that is really important. Their ability to defecate and urinate. We know, with gray horses, they can get melanoma tumors around their rectum. Is that preventing them from defecating normally? Can we do anything about that to improve their quality of life? Or is that a factor in their quality of life? And their ability to breathe without excessive effort. So if your horse has asthma and it's getting progressively worse every year, there comes a point where we have to advocate for them if we can't help them anymore to breathe comfortably on a daily basis. So this is kind of a checklist that we can give to owners as far as the physical factors. So you can put little check boxes by these and you can mark them off for your own horse. So does my horse require assistance to stand after laying down or rolling? That's a big red flag. Is my horse losing weight? My horse is not eating as much as before. My horse is having difficulty eating. My horse is not drinking as much as before. My horse is not as active as normal. So they're reluctant to walk, over to their water. They're stiff. They don't move unless you really make them move when they used to, move pretty easily. My horse has a dull coat. My horse does not defecate or urinate normally, or they have chronic diarrhea or straining. And my horse is not breathing normally. So if any of these boxes are checked for that horse, then that's when, we need to have a discussion about that factor. So is this something that we can address? Can we do some lab work and see what might be going on underlying? Do we need to do some flexions and locate where they're painful? Do we need to do some x-rays and figure out why is this horse, for instance, losing weight? Is it a pain thing? Is it a diet thing? Is it a tooth dentition thing? Is it a herd dynamic thing? Those are all things that we need to get to the bottom of. So then we go to mental well-being, which again, I think is kind of overlooked a lot in the horses. We think a lot about pain, physical pain, and our horses being able to eat and drink and move around freely. But we also need to try to interpret the horse's mental well-being. So when I'm thinking about that factor, I'm trying to look at this horse and see, do they have any indications of fear or stress? Obviously, horses have fear and stress here and there. They're horses, they're scared of a lot of things. But on a daily basis, is every day stressful for this horse or fearful for this horse? And is that new, or has this horse always been just a really stressful horse? If it's a change in behavior, like if this horse suddenly gets aggressive, then why is that horse aggressive? A lot of times we start looking at causes of pain leading to aggression. So is this horse painful, or did this horse move to a new environment they don't like? Does this horse have gastric ulcers? Those can all be reasons for a change in behavior. The level of interest in their surroundings and handlers and other horses. If this horse used to kind of, come up to the stall and say hi, and now they just kind of stand in the back of the stall, not interested in people, that's a red flag that we need to look into. And then their level of participation in herd activities. So are they following the herd around? Are they hanging out with their friends, or are they kind of off by themselves, just sitting in the corner? Positive and negative interactions with other horses and their handlers. Again, that kind of goes back to the same thing. Expressions of playfulness and curiosity. So if this horse used to be, kind of mouthy and play with you and interested in what you were doing, and now they just kind of stand there and aren't interested, that's something that we should look into. And then signs of boredom or frustration, including, these vices such as cribbing or weaving. If this horse has never weaved in his life and now all of a sudden he's weaving every night in his stall, there's something going on that's affecting that horse's mental well-being. And these are all considerations of quality of life, because you can have a perfectly sound horse, but if their day-to-day life is full of anxiety and aggression, if they're unpredictable, those are all factors that are, to me, just as important as their soundness if we can't help them to feel better. So here's like a checkbox for our mental factors. So my horse does not interact with me in the same way, doesn't come to the gate to greet me. My horse doesn't interact with other horses in the same way, stays separate from the herd. My horse is dull, lethargic, or depressed. My horse's behavior has changed significantly, including like increased aggression. My horse shows signs of stress or anxiety. and my horse does not show interest in their environment. So this horse here on the right has a lot of these quality of life concerns just from this picture. So number one is he's standing with his front feet really camped underneath himself. That's a very abnormal stance. That's a pain neurological stance. Like it's not normal. You can also just tell from the expression on his face that he's not comfortable, he's not happy. And so this horse here, just looking at the picture, needs these areas addressed. Is it due to pain and why? And can we help him have a better quality of life or not? So when we're doing quality of life assessments, we have these checklists, the physical well-being, the mental well-being, and most of the assessments are coming from the owners or the caretakers of these horses, right? These are the people who know the horses best. They see these horses every day. Maybe they've seen them every day for 30 years. And so it is easy for them to really know their horse, really know subtle changes in their behavior, stance, what's changed in their environment, maybe to trigger some of these things. And then we're also using more objective measures, such as like blood work, soundness exams, x-rays, flexions, things like that, to try to also figure out if these parameters are being met or not. But I will say every case, every horse, every owner, every environment each horse lives in is very unique, and they should all be treated as their own case. There are no blanket statements when it comes to any of these horses and their quality of life. You can have two horses with exactly the same ailments, but they live in two different environments with two different owners. One, you may be able to greatly improve their quality of life. The other one might be out of options for various reasons because of its environment or financial constraints or owner constraints. And so both of those cases have to be treated very differently. Um, and they're all unique to themselves. So when we're talking about end of life decisions, after we're doing quality of life assessments, no horse should have to endure the following four kind of statements. This is from the American Association of Equine Practitioners kind of guidelines for euthanasia. So no horse should have to have continuous or unmanageable pain from a condition that is chronic and incurable. They should not have to endure a medical condition or a surgical procedure that has a poor prognosis for a good quality of life. And they should not have to endure continuous analgesic medication and or box stall confinement for the relief of pain for the rest of their life. And they should not have to endure an unmanageable medical or behavioral condition that renders it a hazard to itself or its handlers. So if you have a horse that needs lifelong anti-inflammatories to just be pasture sound, these have pros and cons. There's a limit to how many anti-inflammatories we can give these horses. Anti-inflammatories have side effects over time, so we have to weigh the pros and cons with each specific case on how long this horse might be able to be managed on anti-inflammatories or joint injection treatments in order for their quality of life to be extended. But there does come a point where there's not enough pain meds for this horse to help them or joint injections, and that is a reason to have an end of life discussion. Also, if this horse, if it's in a stall 24 hours a day and it walks out sound, but then you go to walk it for an extra 10 minutes and it's really lame, that's not a fair life to this horse. It shouldn't have to sit in a stall for 24 hours a day for the rest of its life. That's not a good mental well-being for this horse. And then the unmanageable medical or behavioral condition. There's horses that have uncontrollable, unpredictable seizures, let's say, and these horses are a danger to themselves and others. And so these horses can have a seizure, roll under a fence, get stuck and injured, then it's an emergency situation. They can be being walked by somebody and have a seizure and injure that person. So that's an example of like a medical condition if those seizures are bad enough and unpredictable enough that would render an end of life discussion for that horse. So I want to touch briefly on euthanasia and the process of euthanasia because I don't know if everybody has been involved in a euthanasia, maybe for small animal, but for horses it is a little bit different because they are much larger. So here in the US, we're mostly using pentobarbital, administered intravenously. Before we're doing that, we're giving these horses sedation to minimize anxiety and to make them calm. The sedation is the same as like what they would get for their dental exam annually. And then we're administering the euthanasia solution, and these horses lose consciousness and they don't perceive their environment or feel pain or anxiety. The solution is an overdose of anesthetic. So essentially, these horses lose consciousness and basically faint before they buckle and fall to the ground. There are other methods of euthanasia that we use. Commonly now, a lot of people are doing intrathecal lidocaine, which is a different method of euthanasia where we are putting lidocaine directly into the cerebral spinal fluid. These horses are under general anesthesia before this happens. And so it's just a different method, and for different cases, different methods are used, whatever is best for that horse and owner and situation. So, in summary, these quality of life assessments are a really important tool to help us evaluate how an individual horse and an individual owner are dealing with the aging process. These assessments should happen often and early, in my opinion. I think everybody talking about it gets everybody on board. We don't want any surprises along the way. Everything is better when it's planned and everybody is on board with the plan rather than it have be an emergency situation and then everybody is stressed. The horse is stressed, the owners are stressed, the vet is stressed. So it's nice when these assessments happen frequently. They're a joint conversation between owners, the veterinarians, caretakers, whoever is involved with this horse, and we're considering all the subjective and the objective measures and making one big picture for each individual case on how we can improve their quality of life, if we can improve their quality of life, for how long, and then a plan when that quality of life starts to decline. So this helps us to prepare to provide the most humane and compassionate death for these horses, which is a responsibility that we take on as horse owners, as owning domesticated animals. I believe it's our duty to guide them along this process and help them as best we can. And these decisions are never taken lightly. And I know they affect everyone involved with the horse. It's not just the owner, it's the caretakers, the stall cleaner, whoever was involved with this horse, the veterinarians, and then also that horse's companions. And I've seen this firsthand myself. I think it's very important that horses, the friends of these horses that pass on, come over and see their companions after they've passed on. It's surprising to me in the beginning how much closure this gives the horses. I've seen horses look for their friends for hours, and then as soon as you bring them over, they instantly find peace and they graze and they seem much more relaxed after they've seen their friend. So I think that is a very important aspect also is the living horse's mental health as well as our mental health after we lose our horse companions. I've put some resources here if anybody's interested. The UC Davis has a great pet loss support program that anybody can attend. And then the AVMA has a little handout on equine euthanasia and kind of the same things we talked about, quality of life and the euthanasia process for horses. So I will take any questions that anybody might have.
I have a question.
Yeah.
I am going back to volunteering for a horse rehab, two of them, and they have significantly older horses, which is why I attended this talk.
Mhm.
And I don't know who determines if a horse um needs to be put down, um if those are the factors you are looking for in the quality of life. Because what we're doing at the ranch is providing them with a with quality of life while they can no longer be ridden by people. And I was curious, how how old typically can can these horses live?
Sure, that's a good question. It really is a very individual question because I have had 11-month-old horses with horrible arthritis that have to be euthanized. And I've had 32-year-old horses that look amazing. So it's hard to say, a blanket statement on how long. And that is why the quality of life assessment is so important because you can't really make a blanket statement on these horses. So as long as they're not checking all the boxes that we're, worried about on the quality of life, then they can continue, hopefully happily to live on their lives.
Yeah,
Um,
they have, I don't know if they're like grants that are granted per horse
mhm,
to care for them in their lifetime, but they are receiving all the medicine, all the veterinary care, all the supplements, the pasture, like wide open walking and um just a really decent quality of life.
yeah, that's amazing. And that's what we can provide for them, right?
Yeah,
Until they start, having some of those problems that we just can't help them with anymore. And that can be a really long life for some of these horses. So, yeah.
yeah, that's good news.
Yeah.
Can you hear me?
Yep.
I just put my 41-year-old mare down last year.
Oh, I'm sorry.
Yeah, 41 years, so it's
That's
pretty
a
good.
long time.
I have two retired horses now from Halleck Creek, and Sam is 30, Buddy maybe 27, and Sam's kind of getting to that point, and that's why Halleck Creek, had to get rid of him because
Hmm.
he was pretty gimpy, and he got to my place and got better.
Hmm.
Now he's getting back to it. I think one of the questions I have, and you showed the horse standing, with the feet backwards, was Sam's feet are forward,
Hmm.
unless he's eating. And then he's fine. It's like nothing's wrong. Uh, but he's definitely in discomfort. And I've been giving him, and another point you made about how long anti-inflammatories, and a little over a year now, he's been getting Equinox. Is that considered a long length of time?
No, I mean, as long as his organ health is good, like a lot of times we check the kidneys on these horses every year when they're on chronic pain meds. As long
Okay.
as there's no side effects, then I keep them on it for as long as they need. But if there comes a point where we're like, it's not helping enough, or it's not getting better to the point where his quality of life is good, then there's other medications that sometimes we add in or we change
Okay.
because there are other options out there, or maybe a different approach. Um, but a year and a half isn't, for most horses, that's not too long to be on Equiox. But again, we are monitoring them closely with kidney panels and all that to make sure that their kidney values aren't creeping up, because that can happen with chronic NSAID use.
Yeah, but he's 30,
Yeah.
and I'd rather see him not in pain. And if the kidneys go, the kidneys go.
Yeah, and those are
Is that acceptable
yeah, those are
kind
the
of
things that
thinking?
we
Okay.
balance. Yeah. So
Okay.
that's what we say sometimes is, say this horse is on a really high dose of pain meds, but otherwise they're doing really well on it. And we know that the side effect is, yeah, one day they might reach a tipping point.
Okay.
And as long as we're monitoring that closely so that it doesn't become a big catastrophe all of a sudden, then, that's the pros and cons that we weigh with these guys. So yeah.
Well, is it, I mean, 1 week he'll be fine, the next week could be horrible.
Yeah.
So it kind of comes and goes. So I don't see it helping him because this has been going on for a year like that.
Yeah.
So
Yeah.
you think possibly a higher dose of something else?
Yeah, yeah, you can
Yeah.
talk to your vet about adding in a different pain medication.
Okay.
And then going through that quality of life checklist too, and then weighing, it's important to weigh the good days and bad days, right? How many good days are they having versus bad days, and trying to make the decision that way too. But there are other options out there sometimes, depending on each individual horse, where we can change the medications or change the environment a little bit more sometimes too.
Well, I think he's in a pretty good environment and eats well and
Yeah.
not losing weight. So this is I'm just wondering about the pain more than anything else, and it
Yeah.
disturbs me every day when I see him.
Yeah.
But he lays down and gets up without a problem.
Yeah.
But okay, all right,
Yeah.
thank you.
Yeah. Any other questions by anybody?
Oh, I have another question if you
Yeah.
don't mind. Uh, companion horse. Whenever I've lost a horse, I've got a companion horse. And I'm at the point in my life where I don't think I want to do that again. And
Yeah.
so, any suggestions for the remaining companion horse?
Yeah.
Other
So
than
some
what you
people,
suggested to show him, I understand that, but
yeah, definitely show him. And some horses are okay living alone. It depends on the horse. Others aren't. So I've had some people even get like a goat to live with their horse. Temporarily, or some people kind of take a horse on loan from a friend if they have like an older horse that they know isn't going to be around for a long time and they don't want to fully commit to getting another horse. Some people will kind of let you, board their horse with you basically for the next few years or so. But also I recommend like a goat or a sheep. Usually that's good for the horses too, and to keep them a companion. But some horses are okay living alone.
uh, yeah.
So, yeah.
Okay.
Anyone else have any other questions?
Yeah, I got a couple real quick. I'm not a real horse person. This is Rich for people who know me. You mentioned behaviors, cribbing and weaving. I think I know what cribbing is, but I haven't heard the term weaving before. Could you explain that? And secondly, then I'll mute myself. Could you maybe go through, or maybe April can, the decision around Duke, what sort of things? I wasn't really around to understand. I mean, I knew him pretty well, and he was a buddy of mine, but he seemed to always kind of be in pain a little bit. But I guess something changed that caused you to euthanize him. So if you could, if someone wouldn't mind sharing that, I'd appreciate it.
Yeah, definitely. Yeah, so weaving is a vice of horses where a lot of times it happens when they're in the stall, and it's just exactly what it sounds like is they stand in the stall and they just weave back and forth incessantly. And it happens a lot. It's not just a here and there type of thing. And so it's kind of like cribbing where they just kind of do it without even thinking. A lot of horses at like the racetrack do that because they're stuck in a stall all day. Usually horses that are turned out don't do it, but it's more horses that are stalled. So if you had a horse that was on stall rest for an injury or something like that, they might develop that habit of weaving. And then for Marmaduke, this one X-ray was actually of Marmaduke's leg. This one on the right here was the arthritis in Marmaduke's pastern. And Marmaduke had that when he came to Halleck Creek, and we tried to manage it. We did joint injections on his pasterns to try to help him be more comfortable, which are very targeted treatments into that joint to try to decrease inflammation and pain. Marmaduke was on Equiox for pain, and then he was also on a second anti-inflammatory Tylenol or acetaminophen, which is the same drug. So he had two stacked NSAIDs, which is something that I only do with horses that are kind of what I call kind of on hospice, right? These horses are kind of end of life care. We're trying to give them a good quality of life for as long as we can. And so we tried everything with Marmaduke to try to get him comfortable. The things working against Marmaduke are his size. You know, a horse that big with legs this bad, it's really hard to get them comfortable. His joint space was collapsed on one side, so it was kind of just bone on bone. And with such a big horse, that's really a lot of weight on that joint. And, we never got him super comfortable. I think that was the concern with Marmaduke. He always had a limp. He was always painful, but for a long time he seemed to be managing okay, but we knew he was on borrowed time. And then in the very end, correct me if I'm wrong, April, but what we were noticing was he was struggling to go just walk over to his water. So he wasn't as interested in walking across the pasture to get his water. And that's something that, and walking to go get his food and things like that. He was slower to go get his food. These are very subtle signs, but they're very important signs because, again, we want to catch these things before it's a really big deal. If you don't catch that soon enough, he might have colicked because he wasn't drinking enough water or eating, and then it would have been an emergency situation. So they noticed this, and that's what helped them make the decision that they think his pain was getting worse because in the past he was always willingly walking across the pasture to get water and food, and then he really started to slow down. So that was a factor in his quality of life.
I can also chime in a little bit on that, Haley. So for probably about 3 weeks before we made the decision, I had noticed that he had slowed down coming to get his food. And then it increasingly, he was leaving hay. And anybody who's met Marmaduke, he likes to eat. So it got to the point that he just wouldn't come over and eat his food. So for me, I didn't want him to get to the point where maybe he laid down and couldn't get up, because then that was going to be a much bigger crisis for us. And so it was kinder for us to let him go before we got to that point.
I think I can also chime in a little bit. We also, for those that got to see Marmaduke, I think we got to make a really lovely choice for him. I'm going to choke up because I'm like that, but of that, his last week of life was really great. And I think that's a gift that we can give them if we are paying attention and get those choices too. He got to, we gave him more NSAIDs than you're probably supposed to, or you're definitely supposed to. It was not sustainable, but to make him as comfortable as we could possibly make him for that last week. And we kind of got to make that choice for him and have him kind of go out on a high, which I think is a really kind thing to do. And if you're paying attention and watching those things, you get that opportunity to do that, which is, a gift, I think.
Yeah, I think that's one of the best things about having these discussions and making these plans, because you can have that time with the animal to really spoil them a bit, if you know their time is limited and you're prepared for that. Like Marmaduke got to eat all the snacks in the world, for his last little bit of life, and it was,
Yeah, he relapsed.
yeah, and it was amazing. Because if it's an emergency situation, if you wait too long, if you don't know what's coming, you just don't get to spend that time and spoil them and kind of give them the send off that they deserve, really. So that was good for Marmaduke.
I guess I kind of have a question, and it's great we're having this conversation, and that's really why we wanted to have you come talk to us, because we probably will have more of these situations as the herd ages. And from our internal perspective, we're seeing these things happen, but then from the external perspective, or even just, volunteers, it might seem very sudden when this decision is made. And so I wonder if you could just speak to kind of the ethics around making that final decision, is it better to do it before, it gets too advanced or kind of before it becomes obvious to the larger community? I guess from my perspective as a marketing person within this community, kind of how can we communicate these complex ethical decisions around when is the right time?
Yeah, and I think it's hard because again, when you're looking from the outside, like you said, it's hard to see all the behind the scenes discussions that we have about these horses, all the things we try with these horses. Obviously, you're not promoting all of that to everybody, telling them every tiny thing along the way, but these are discussions that we're having every time I see these horses on little subtle things. And I think a horse that very obviously needs to be euthanized is one that's probably, gone too long, unless in an emergency situation, that's different. But we try to make these decisions before they are a huge problem. So that's why it may seem sudden and subtle. However, it is really something that's been compounding over time. Um, and we don't want it to become a really big problem. So, yeah, I guess having these conversations and also, the volunteers picking up on these things too. If they notice something really subtle, it's actually really important to mention, like, Marmaduke not finishing all his hay, like maybe that's, oh, maybe just today he doesn't want to eat, but it's really important to mention these little things because we don't want it to become a really big thing in the future. So, and I also want, everybody to realize that these discussions are had with many people too, right? This isn't just one person deciding that this is the plan for this horse, and we're taking, like I said, all the subjective data, all the objective data and putting it together. And there's a bunch of people involved. None of these decisions are taken lightly. This is the worst part of my job, is euthanasia. But the thing that helps me is every horse that I euthanize has a reason to be euthanized, right? So nothing is done and unethically. I couldn't live with myself if I euthanize a horse that I didn't think, their quality of life wasn't worth living anymore, that they're suffering on some level. And everybody involved is the same way. Everybody that has horses, I haven't met anybody who doesn't feel the same way about that. So they're not taken lightly, and a lot of people are involved. And trying to let them go on a good day versus a bad day, it seems, hard to do, and it is hard to make that decision on a good day when they look good, but you're hoping to prevent the bad days that are coming, helping to save them from those days. So,
Yeah, thank you for that.
yeah.
Hey, I just want to kind of put in my 2 cents. This is Gina. Um, I actually just recently came from the research community, so euthanasia was a very big um, deal in my job, and we had very strict protocols on what that kind of looks like, and we took into account body weight, body condition scores, appetite, quality, like what their demeanor was and everything. And so these are kind of things that I think we do in the horse community as well. We look at all of that. And if anything depletes in that area, um, we have to really take that into account before, and when we're making these decisions. Um, and not to like sidetrack, but like I just had to put my dog down and it was the same thing. It's like quality of life and how is he going to react when he gets up in the morning or react from the surgery or any of these things. So these are things that I think that the veterinary staff in April really look at and make sure that we take into account with these horses and their quality of life. That's all.
I will throw a little bit into that too. I appreciate it for sure, Gina and everybody. Uh, it's there's a whole crew of us behind the scenes that are talking. I mean, Maya and I are conversing about horses all the time. I'm talking with Dr. Casbeer. Maya's talking to Dr. Casbeer. We've got Molly. We've got volunteers that are seeing things like this is happening all over. It's an interwoven web of things that come to these decisions, and everybody's part of it.
Yeah, and speaking for myself, like, I'm fully transparent on, why we make these decisions, and I'm happy to answer any questions if anybody ever has any questions on why we're making these decisions, if you want, my perspective on things. So
All right. Well, I think we made it all the way to the end here, and we are in pretty good time. So I'd really like to thank Dr. Casper for giving us her time to discuss some of these things. And I really appreciate you guys all being here, because I think this is a really important topic that we don't spend enough time educating and learning about. And like we've talked about all throughout this, is that it kind of comes as a shock, even though behind the scenes it's not. So, yeah, I just want to thank everybody for their time tonight.
yeah, thank you guys for coming. If you have any questions, April has my email if anybody wants to ever email me any further questions or anything. I forgot to put it on the slide, but April has it.
Thank you for hosting this. I think this is amazing.
Yeah, thanks. Appreciate it.
Thank you guys.
Thank you so much for
Thank
the
you. That was-
information. It was wonderful.
That was great.
Thank you so much.
Thank you.
Bye.
Bye,
Bye.
guys.
Bye.
Thank you.